Guys, so this video is going to be about my experience with having skin cancer, specifically melanoma. I just wanted to refilm this because I made a video years ago about this experience, and it came from a very resentful place. And right now, I definitely don't have those same feelings about it as I did then. I was much younger then, and honestly, going through that experience has been the best thing that has ever happened to me. It has brought me to the greatest joys in my life, and I just want to help somebody that might be going through the same situation or a similar situation to just have that knowledge that sometimes life throws scary crap at you, honestly, like terrible things. But a lot of times those things can lead you to the greatest joys of your life. So if you're in that position where you feel like everything is terrible and scary and why this is happening to you, I mean, a lot of times there's a reason for that. And I feel like everyone can handle what's thrown at them not if they try to. I don't want to dismiss people's suffering, but a lot of times it can look different in the end. And that's why I wanted to share my story. I hope that makes sense. I filmed this video years ago, but I mean, like I said, it was a really bad video, and I just really wanted to give the new perspective of it. So I was 23 years old. I had a mole on my leg. I went to my doctor, and he sent me to a dermatologist. Everyone was telling me it was fine, it was nothing, and I believed them. I mean, I didn't think anything could happen to me, and I was wrong. So the dermatologist just numbed the area around the mole and scraped it off with what looked like a razor blade and sent me on my way. So a couple weeks later, I got a call from the doctor that my test results came back and that it was positive for melanoma and that I had skin cancer. And I just remember I had just got on the freeway, I was driving to work, and I was just shocked. Like, honestly, it felt so surreal. Like I was watching myself going through this experience, and I just didn't know how to feel. I didn't know how to understand what was happening, and I didn't know what that meant. I mean, I had a friend, her name was Sheena, and she passed away the year before all of this happened from melanoma. But at that point, hers, when it was diagnosed, was already stage 4, and it was all over her body. And honestly, she really didn't have a chance. Just it was a terrible, terrible thing to see. So to know that it was happening to me and that I knew what the consequences could be. I mean, melanoma is the leading cause of death for skin cancer. And at that point, I had felt invincible. I had felt young and carefree, and that these things couldn't happen, and it was happening. So with melanoma, there's 4 stages. There's stage 1, which is where it's just on the surface of your skin. There's stage 2, where it's gone deeper or larger into the areas of your skin. There's stage 3, where it has spread to your lymph node, your closest lymph nodes, and stage 4, where it has spread to other parts of your body. So they didn't know what stage I was at. They sent me back to the dermatologist. So at that point, the dermatologist just took a little bit bigger of an area he removed and had that tested. So a couple weeks after that, they gave me a call back and said that the cancer cells were all the way to the edges of that sample, so they couldn't be sure that it was all gone and that my cancer was now more than stage 1, so I would have to have surgery. So they had me meet with a surgeon, and the surgeon said that they would be removing a larger area of skin. So mind you, my cancer was on my leg, specifically behind my knee. So there's that crease behind your knee. It was 1 inch below the crease, so it was on the back of my calf. And it was a large mole. It was black. It was a little larger than a pencil eraser. It was asymmetrical, bumpy, like it was all the signs of a bad mole. But I just had never gone to the doctor because I didn't have insurance and I didn't think anything bad could happen to me. So I met with a surgeon. They said that they were going to take quite a large area, and that since that area is so far from my heart, it's going to be hard to close that kind of incision. So they would need to do a skin graft where they remove skin from the opposite leg, and they use that skin to cover the area that they remove skin from. And all of this was just crazy to me. It was so confusing and so overwhelming. But luckily, like, my mom was with me and she was just reassuring me the whole way. It was just such a scary experience. And then they also said that they were going to remove some lymph nodes from my inner thigh because those are the closest lymph nodes to where the cancer was. So for my surgery, I went in, I think it was November 1st. Oh no, it was October 1st. October 1st, I went in for my first surgery. I had to have 2 surgeries. So the first surgery on October 1st, they removed a large piece of skin on my upper calf. And they decided that they were not going to be able to close the incision that day because it was just such a large area and it's so far away from my heart that the chance of a skin graft working is a lot lower. So they wanted to prep the area for a skin graft so the skin graft would be successful. So they just removed the skin and they took the lymph nodes from my inner thigh. So my inner thigh, I have a scar about that long where they removed the lymph nodes and it was closed with stitches. And then the part on my calf, they had to leave open. So this was super traumatizing for me because what I had to do was for a month, they had the area packed with a sponge and then it had a plastic over it that was vacuum sealed to my leg. So that area was still open, but it had like literally a sponge inside it and a vacuum seal that had a hose attached to it. And the hose attached to a little canister in a backpack or kind of like a purse that I had to carry with me if I went anywhere. So mind you, this is really gross. So if you don't like gross stuff, you shouldn't listen to this part. But I wasn't prepared for how gross it was going to be. So it was so shocking for me. So that's why I wanted to tell you about it. The hose and the little purse basically is for the wound to drain. So the suction provides the vessels of the blood area of that. I don't even know if I'm saying this right. It made the wound to have a better blood supply so that the skin graft would be successful. So I had to wear that for 30 days. So every other day a nurse would come to my house and she would change the dressing. So she would change the sponge, resection it, empty the little purse with the fluid that was coming from the wound, and it's called a wound vac. Pretty sure that's what it's called. So during those 30 days, I really was too embarrassed to go anywhere. I could walk. I was fine walking. It was a little bit painful. It wasn't too painful, but I had pain medicine that was managing my pain fine. When she was changing the dressings, I couldn't look at it because I didn't even want to know. I didn't want to see it. I didn't want to know what it was, like an open wound on my leg. Like, I just didn't want to see it. So I never looked at it, but I mean, my sister did, and my boyfriend at the time would look at it and said it was really gross and told me not to look at it. But I remember going to a movie. Like, my friends were just like, come on, let's go. So I went to the Harry Potter movie, and I don't know which one it was. They're like, you're gonna hate me, but I feel like they're all the same movie. But it was one of the Harry Potter movies, I think one of the last ones. And I just felt like you could hear through the tube the sucking and the dripping into the canister in my purse. So I had to leave. I had crutches because they didn't want me to put that much weight on it. But again, with the crutches, I could walk. It wasn't very painful. So it was just uncomfortable to have that thing just like sucking fluid out of my leg. It was just so gross. So gross. And that was 30 days. After the 30 days, they were able to close it with a skin graft. So what it looks like is literally like they took one of those cheese strings and sliced a rectangle off of one leg and sewed it onto the other leg. So that was my second surgery. It was on November 1st. And I didn't really get to see how everything was because when they put the skin graft on, they put the dressings on it and bandages, and then they stapled the bandages to my leg because they wanted as little movement to my leg as possible. So they didn't want anything to move. They wanted it to stay closed and unexposed to any germs for as long as possible. So that was stapled to my leg for another 30 days. So during those 30 days, I was basically bedridden. So I would have a nurse come once a week to check on me, but I wasn't supposed to get up unless it was to go to the bathroom. And I was supposed to try to avoid getting my leg wet. So I would shower sitting on a milk crate in the shower with my leg out of the shower, and that's how I would wash myself. So it was a struggle. I moved back with my mom so that she could help take care of me because I needed a lot of help. The skin graft on my other leg was just an exposed rectangle of skin that felt like a really bad sunburn. So the hardest part with that was it was such a thin piece of skin, but I feel like it's kind of like when you have a paper cut, like the little cuts hurt so much more than the big cuts do. So it was so painful. And then new skin would try to heal over it, and when we would change the bandages, the new skin would rip off. And it was traumatizing. Like, I remember my mom wanting to change the dressings, and I would just be like begging her not to because it hurt so much. And we did everything that they said to do, but the only thing that worked was maxi pads. So we would just put the the ointment on the maxi pad, and we would tape the maxi pads to my leg. So it would take 2 maxi pads side by side to cover the rectangle of like exposed skin. So we would tape that to my leg, and that was the only thing that wouldn't stick and that would allow the new skin to grow back. So that took about a month to heal. And then I had a month of being on bed rest, trying to move my leg as little as possible so that the new skin would attach to my leg and start growing and be a successful surgery. So thank God the second surgery was successful as well. At the end of November, they removed the bandages and saw that it was healing really well. So they took the staples out, which was super painful. But again, like, I'm so grateful for how everything went. Everything was successful. Everything ended up healing properly in the end. It was just 3 months of my life that was a struggle. So after they removed the bandages, they still had me taking care of the wounds. Like, I still had stitches and everything that were in my leg for another month. So I think it was like 2 months that the stitches were in my leg for. So it wasn't until the end of December that I was able to start physical therapy. So now at this point, for 60 days, I didn't walk at all. So it's crazy how much muscle strength you can lose in that amount of time. So I had to learn to walk all over again, basically. I mean, it was my one leg I was okay with because I was doing flexing exercises and like lifting my leg up and down and stuff. So I was trying to keep it active. But the one that had the skin graft, I wasn't doing anything. So it took about, I would say like 6 weeks. 6 weeks to be able to walk comfortably. So I was started out with crutches, and then I transitioned to a cane, and then after the cane I could walk carefully. So in this time I just was reflecting on my life, things that I wanted, things that I didn't want. And during this time is when I fell in love with my husband. So he was my friend at the time. And I realized I was not in a happy place in my life. And I realized how precious life was. So I made a lot of changes and choices in my life. I chose to be by myself. I chose to think about my future more. And during this time, my husband was just there for me with whatever I decided to do. Like, with everything, he was just super supportive to me. And he was literally my rock to make it through everything. So having a support system was really the best thing. And towards the end of it, once I was like back and out the other side, I saw something in him that I never saw before. And I realized that I was in love with him. And since then, I mean, that was our great love story. That was what brought us together. Like, me seeing that I deserved to have that love and that care, and seeing a different side of a friend, that was literally the best thing that ever happened to me. I feel like if that experience didn't happen to me, I may not have seen that. I may not have changed the path that I was on. I may not have allowed myself to see him in that way, and I might not be in such a happy marriage. I wouldn't have my daughters that I have now. Like, going through this experience made me change my life to make me happy, and I'm the happiest I've ever been. And this is the reason for that. No one knows. Every time someone finds out I had skin cancer, a doctor sees a scar and it's like, oh, what happened? And I let them know, and they're like, oh, does it run in your family? Do you spend a lot of time in the sun? And no, the answer is no. I don't have any of the risk factors for it. But I really feel like it happened to open my eyes to what my life should be and what it could be, and to get me to change paths. So it was definitely the best thing that happened to me. It was a struggle for a few months, but after that I got pregnant with my daughter Scarlett. I had a successful pregnancy. I have 2 beautiful daughters now and an amazing, loving husband. My scars have healed so much. Where the skin graft was taken, I'm going to include pictures at the end of this of my scars. So I have a scar where the skin graft was taken off. I have a scar where the lymph nodes were removed. And I have a scar where the cancer was removed. So by February, they were able to tell me that I was cancer-free. The sample that they had took had clear edges, clear margins, basically. So I've been seeing a dermatologist every 6 months since then, and now I only need to see him every year. So I've come out the other side. The chances of it coming back now are so slim. It would be like having it for the first time all over again. So the only thing besides the scars as a side effect that I have is because of the lymph nodes being removed, the left side of my body gets more swollen. Specifically my ankle and my foot and my calf becomes more swollen than the other side. So if I have a lot of salt or if I have a lot of activity, that side of my body gets swollen. So sometimes it's frustrating. My shoe will be really tight, or my pants will be really tight on one side and not the other side. And it can be pretty noticeable. It's like edema or something. But compared to having my life back and having this amazing life, it's definitely worth it. Like I said, I'll have pictures of the scars. Sometimes people see the scar on the back of my knee, and a lot of people think it's a burn. But it's definitely a conversation starter, and I definitely don't feel like a victim. I feel like it's an experience that I went through, and I was fortunate enough to catch it early. It ended up being stage 2. When all was said and done, and I know now that I can be very vigilant about my health and about my kids' health. If there's something you need to get looked at, get it looked at, because you never know. It happens to everybody, or it happens to anybody. So if you have any questions, specific questions, feel free to message me here or on Instagram if that's easier for you. I'm definitely here for support or questions if you're going through an experience like this, or if you want any more information about it. Definitely protect your skin. Definitely get checkups. Go to the doctor. I'm a strong advocate for skin safety because of that. People show me their moles all the time. I don't feel like I can diagnose you. I'm definitely not a doctor. So that maybe you don't want to do. Send me pictures of your moles. That's probably not a good idea. But definitely make an appointment with your doctor. Go to a dermatologist. Get your skin checked. Everyone should be checked once a year. So it's summertime, you're spending a lot of time in the sun. Just make sure you're wearing sunblock and you're protecting yourself, and you're getting checkups every year to make sure you're being as healthy as can be. So thank you for watching. I hope this helps somebody or encourages anybody to make an appointment with their dermatologist. That's what this video is for. And I will see you guys in another video. Hopefully not such a intense video, but yeah, thank you guys for watching. See you next time. Bye.